Hello friends, I am Dr. Ankit Goel, consultant psychiatrist and faculty for psychiatry. Now, first of all, I would like to congratulate to all the students who have qualified the FMGE August 2020 test. My best wishes for a great career ahead. Now, today I'll be focusing on students who will be giving the FMGE December 2020 exam. Now, as we know, the exam date have been released, which is 4th of December 2020, roughly 2.5 months from today. Now, those who have given the August exam, or you might have heard from your seniors, from your colleague, that there were a lot of clinical questions or the so-called long question in the exam. Now we've been getting a lot of messages on our social media platform. Students have been asking that I got tensed seeing the questions. I knew the answer but marked it incorrect. But when I came back home, I read the question again. I was able to mark the right answer. So how should we go about such questions? So today we'll be focusing on the approach to these clinical questions or the long questions. Now please understand the first and the very important thing, which is the mindset. Now in the past few years we've been giving a paper in which there are a lot of one-liners, there are direct questions have been asked. So mind tries to resist any change. Mind wants to stay in the comfort zone. But we need to understand that change is the only thing which is constant. Now, there is an assumption that clinical questions are always difficult, or students would say they carry a disadvantage. Now, I would want you to understand that this notion, this assumption is incorrect. Why I am saying this? Because when we are approaching a clinical question, please understand the examiner gives you more hints, more clues and more information. The more lines there are in the question, the more information you have been provided. So you may not know one piece of information, but you may know the other piece. So this could actually help you to reach to the correct answer. So there are many ways to reach to a correct answer in a clinical question. On the other hand, in a one-liner, you either know the answer or you don't know. Another very important thing when you are seeing a clinical question is to focus on keywords. Now there are certain keywords, some key information in the question which are very essential to solve the question and reach to an answer. For example, you may be given a clinical question in which there is a 30-year-old female, there are a lot of symptoms, a lot of information about the patient is given, and each time she develops symptoms, there is a feeling of impending doom or there is a fear of dying. Now, these words will hint you that you may be dealing with a panic disorder. So there is always important and always good and essential that you try to always find out certain keywords in the question. Another very important aspect is that sometimes the last line of the question carries the most important information, or in fact it is the actual question. Many a times, even if you read the last line, you may be able to solve the question. So it is very important to keep that thing also in mind when you're solving the questions. If there is a lot of information in the question, there may be a lot of subjects which you've studied might be integrated. But please understand that this integrating things help us remember better. So this can actually be an advantage to us. Now in psychiatry, if we discuss schizophrenia, we will discuss in etiology the various pathways of dopamine, which you generally would read in your first year in your biochemistry or your physiology. Okay, so we will discuss that there are 4 pathways and there are 4 important dopamine receptors, and we'll understand how dopamine is implicated for positive symptoms. So in one pathway there is increase in dopamine leads to positive symptom, and in one pathway there is a decrease of dopamine leading to negative symptom. Then we know that antipsychotics, which we learn in our pharmacology, which are used, carry an important mechanism of action, which is antagonism of dopamine, especially D2 receptors. So now we can then integrate, it is the D2 receptors which are blocked. We also know that there are the other 2 pathways in which if dopamine is blocked leads to side effects like extrapyramidal symptoms. Okay, side effects like galactorrhea and amenorrhea, right? So in this way we will integrate a first year subjects, a second year pharmacology subject and a final year subjects. So in this way we are able to remember things better. So then you would not have to mug up the side effects, because you will be able to actually understand how these side effects are produced. Now, I would also want you to understand that take this change which is occurring as an opportunity, as a chance. Why I'm saying this? Now, please understand, in the future, a lot of you may be, doing specialization. Many of you may be, working as a physician, as a general practitioner. Please understand, learning, integrating things, learning clinical things from your beginning will help you, and it will come as a handy tool in your practice, whatever you do in the future. And sometimes, even, when you are around your family, your friends, and a medical advice is necessary from you, then you will be able to have a better understanding and would be able to give a better advice. Also, please understand, those of you who will be preparing and eyeing for your future exams like a NEET or a NEXT, then again, learning through this change will help you score better and will help you achieve a better rank more quickly in the upcoming exams. So take this change as a chance, as an opportunity for yourself. I understand one thing which is important when you get clinical question is the problem of time. So time management becomes very, very essential. And one of the most important thing to manage time in a paper is to give lot of mock test and grand test. So during these 2.5 months of your preparation, try to give as many grand tests as possible, and also try to analyze how you're doing it, and whatever changes you can do to improve your time management, improvise upon that, so that on the day of your exam you're able to have a better time management. Now, also I would want you to understand that now you should study with an open mind. There are certain facts which we need to remember, and there are certain concepts which we need to understand. So it is a mixture of both. Not everything is a fact and not everything is a concept. So please understand that there are facts and there are concepts, and you need to understand and learn in both of them. So it is very important that you study now with an open mind. Make your own notes. Again, a very important and a very, very crucial step in your preparation. I know that in the market you will get a lot of handmade notes, but if possible, or you have time, try to make your own notes whenever you are able to. This will again help you to remember things better. Okay. Now, one more thing, please understand that basics lies the foundation stone of your preparation. So even if it's a one-line question or it's a clinical question, you have to have strong basics. And once you have your strong basics, you will be able to solve any question. It may be a one-liner or a clinical question. Now, as I always say in my classes, it is always wise to revise. So always have sufficient time for yourself to do at least 1 or 2 revision before your exam. Okay. Now you can follow us on Facebook. You can join our group Psychiatry by Dr. Ankit Goel, and you can follow us on Instagram, and also you can join our Telegram group. If you like this video, please like and subscribe our YouTube channel, which will motivate us to give more such videos, and also do mention in the comment section what all videos you would want to see in the future. Thank you, best of luck, and let's keep going.